Good morning. Today I'll be talking about my two favorite general considerations and my two favorite patient considerations from the telehealth article. The first general consideration that I found to be very important is that the examiner should tell the patient that they may have to look away from the camera at times during the examination in order to record things. Now, I think this is important because you need to build a good rapport with your patient, even if doing telehealth. And if you're constantly looking away or looking down, the patient might think that you don't care or you're uninterested. So, letting them know why you would be looking away would be very important. I also think that another general consideration that I found to be my favorite was considering demonstrating the maneuvers that you want the patient to perform. This is important for obvious reasons. I think one, it'll save you a lot of time instead of having to explain to the patient in layman terms what you need them to do. Just showing them, I think, will be more efficient and will save you time and get you a more accurate result. Now, the patient considerations that I chose to talk about today, the first one is going to be having another person use the camera if possible while doing the telehealth examination. I think this is important because the cameraman can follow the patient through different transitional movements, whether they have to go from supine to sitting or standing or different active movements like walking. I think it would be better if you had another person holding the camera so you could follow them as they do these things instead of the one person trying to manage all of that by themselves. I also think that if you have a camera person or a cameraman, it would help you get a little bit more close-up view to some of the things that we might be having the patient palpate. For instance, if we're having them palpate at the shoulder, you could have the cameraman zoom in to make sure they're actually palpating the correct area instead of having a only a zoomed out version. I also think that these other two patient considerations kind of go together, but having adequate room to perform all the maneuvers, along with having no distractions or a cluttered environment, are both very important. The distractions can be time consuming, it might lead to miscommunication, and that'll just cause the whole process to be more challenging. And obviously, if they don't have enough room to do the things that you need them to do, that's going to be an issue because you won't be able to get the findings. So just making sure that they have a space that they can go to and perform all of the examination steps that you're going to need them to do, and without distractions or other people there who might just cause confusion, basically. So yeah, so those are my two. Once again, the patient considerations was just having another person holding the camera, and then the adequate room for full range of motion and free of cluttered environment and no distractions.